What? Missing M? Your blood glucose level is very low. This is actually hypoglycemia. No wonder you're looking so tired. If you don't mind, please help me get oral glucose. When it comes, ma, I'll have to give it to you dissolved in water, and you will drink this and just wait here for 15 minutes, and then I'll test your glucose level again. Hi beautiful people, welcome back to Marvel Family. On this channel every Monday I share beauty and lifestyle content. Every Wednesday I share do it yourself and skill acquisition videos, and every Friday I share pharmacy gist and health tips. From the short playlet you watched, hypoglycemia is real. Hypoglycemia is a condition called low blood glucose or low sugar, and it occurs in a situation where the fasting blood glucose, that's the glucose level measured at the point where a person has not eaten, is less than 70 milligrams per deciliter, which is equivalent to this. Hypoglycemia can exist in patients with diabetes or in patients that are not diabetic. In diabetic patients, hypoglycemia often results as a result of overdose of insulin or high intake of insulin, and as such, the blood glucose level gets too low, or an overdose or a high intake of oral anti-diabetic medications. In diabetic patients, it can also arise as a result of too much of insulin. In patients who are not diabetic, the causes of hypoglycemia range from kidney diseases, hepatitis, alcohol, exercising for too long, eating too little food, or drinking too little water. The symptoms of hypoglycemia can range from headache, to sweating, to tiredness, to vomiting, to pale skin, to seizures, to confusion, to slurred speech, to blurred vision. And all of these symptoms need to be avoided immediately. The diagnosis of hypoglycemia is simple. It could be through a rapid diagnostic blood glucose test, where a patient sample is taken and tested, and the patient is confirmed to be hypoglycemic if the blood glucose level is less than 70 milligrams per deciliter. In a case of hypoglycemia, it is important that before management, the root cause of the problem is discovered. Like I mentioned, a wide range of causes. If the person is exercising for too long, if a person is dehydrated or hasn't taken a lot of water, if a person is eating too little food, if a person has taken too much of alcohol, if a person is smoking, if a person has a reactive disease like hepatitis or a kidney disease, it is possible that the patient can come down with hypoglycemia. So that needs to first of all be discovered and properly handled before further measures are taken. However, there is the 15-15 rule in the treatment of hypoglycemia. And this is done by testing to check a patient's blood glucose level. And if it is less than 70 milligrams per deciliter, oral fast absorbed carbohydrates or glucose is given. It could be banana, fruit juice, or glucose. And after that, the patient is kept for 15 minutes in a resting position, and the blood glucose level is taken again, and the process repeated over and over until the patient's blood glucose level is raised above 70 milligrams per dl and up to its stabilization. If you have any other questions about hypoglycemia, like I have mentioned the symptoms, I have mentioned the diagnosis, I have also mentioned the causes. It is important that you stay hydrated, eat healthy, and eat properly. If there are any other topics you would like me to talk about in my next video, please do well to drop it on the comment section. Like, share, subscribe, and turn on your notification bells, because I will see you in my next video. I am still Pharmacist Marvelyn, and it's a pleasure to have you with me. I'll be doing a class tomorrow on WhatsApp in our closed WhatsApp group on everything about hypoglycemia, so you don't want to miss it. The link is in the first comment. Bye for now.